Here are the key issues to remember for mitral regurgitation. It is a common disorder which carries an excessive mortality risk. The hemodynamic features include volume overload and an afterload reduction. The most common primary or structural cause of MR is mitral valve prolapse. The most common secondary cause is annular dilatation, which occurs as a result of left ventricular dilatation. Echo can help to clarify the etiology and mechanism of MR. To evaluate the mechanism, you look at valve morphology and also at the jet direction. Flay leaflet can be caused by rupture of the primary, secondary cords, or the papillary muscle. Therefore, the degree of regurgitation varies in flay leaflet. The most common part of the valve which is involved in flay leaflet is the medial scallop of the posterior leaflet, the so-called P2 segment. To quantify MR, you have to use an integrative approach which uses color Doppler, in particular the proximal portions of the jet, the flow convergence zone, and the vena contracta. You can also use the PISA method. However, the PISA method has a number of limitations. And you also look at the secondary findings such as left ventricular volume overload and to a certain degree also the size of the left atrium. Very important, the degree of morphologic changes of the mitral valve do not necessarily reflect the severity of MR. What are the surgical issues in MR? We know that repair is better than replacement because it preserves left ventricular function. Surgery should be performed in symptomatic patients as long as their ejection fraction is above 30%. We should also operate asymptomatic patients if their ejection fraction drops below 60% or if the end systolic diameter increases above 45 millimeters. If a patient does not meet these criteria and he has severe MR and is asymptomatic, you have to closely monitor him with echo with respect to function and size of the left ventricle. And you can also use the approach of early surgery. However, in these patients you have to have a high likelihood of successful repair, a good surgeon, and a patient who is willing to undergo surgery.